Welcome back and thanks for staying with us. This is Rapid Dawn on Rapid TV. Welcome to the 9 o'clock hour. My name is Martha Alu.
And my name is Victor. Okay, glad to be back on Rapid Dawn this morning. And of course, it is time for the big conversation. And big ups to Victor Adeyemi for bringing us those sports updates again. Also, let me not talk about it.
Whatever. You know, I always tell you about this bragging that you guys do all the time. I'm really hoping for you guys.
Our hopes are really high.
That you get to the very end. It's not about winning this here and there. It's about just getting to the very end, which I think is one of the major content or prayers for you guys.
I mean, it's a prayer.
It's been a long journey.
Yeah, it has.
They haven't.
I think all Arsenal fans have got to come together now for a crusade, because
it won't work. What you have done how many years ago?
No, we've not done a crusade before, so it's about time right now for us to pray against every cupletness.
But anyways, let's get on to today's conversation. And like I said from the start of the hour this morning, we're having a conversation centered around immunization. Vaccines. These are very important conversations, but they remain one of the most powerful public health tools in human history. Now, according to the World Health Organization, vaccines have saved more than 150 million lives over the last 50 years. That is about 6 lives every minute, every day, for 5 whole decades. They protect against more than 30 life-threatening diseases and infections, from measles and polio to meningitis and cervical cancer. Yet, despite this progress, the challenges remain very urgent. The WHO also says that nearly 20 million children missed at least one vaccine dose in 2024, while around 14.5 million children globally missed basic vaccinations in 2023, leaving them vulnerable to preventable diseases. This year's World Immunization Week, observed from the 24th of April to the 30th, which is today, carries the theme "For every generation, vaccines work." So it is not an obsolete conversation. It is a reminder that immunization is not just for infants. It is a lifelong protection strategy and a cornerstone of national health security. But here in Nigeria, vaccine hesitancy, access gap, misinformation, which of course we did make mention of a few, and missed routine immunization continue to threaten progress. So today, we're going to ask very important questions. Are we doing enough to protect our children? What must change? What are these cultures, these traditions that hinder people from fully embracing the importance of vaccination? How can we address this? And of course, we have an authority in that field here with us today. We have Mrs. Margret Adeyemi. She's the State Immunization Officer. Thank you so much for joining us in the conversation.
Thank you so much for having me.
Welcome and good morning.
Welcome. Good morning.
Yes, so we know, being the State Immunization Officer, of course, it indicates that you have vast knowledge, especially when it comes to immunization and what should and shouldn't be done. But for people who think that conversations around vaccination are still very obsolete, it's important that you tell us this morning what immunization is, why it is important, and why it is still a conversation that is relevant up until now.
Okay, thank you very much. As you have said, immunization is one of the major public interventions that have been proven to be effective, safe in preventing children from preventable childhood diseases. Not only children, but it has been proven that it saves life. It prevents people from preventable diseases that could have probably killed. All these diseases that we are talking about, they are diseases that are quite preventable, but if not prevented, they are very, very deadly and could be fatal. Some, even if they miss it, they didn't die, could leave a very severe complication that the person that is infected out to just cope throughout life. So it is very, very important. Immunization is very, very important because it saves lives. It prevents diseases. It prevents outbreaks of diseases, and it makes the community and the entire populace to live healthy and strong. What I mean by healthy and strong, if you are being prevented from infections and diseases, at least the likelihood that you live a very longer and a very healthier life is very, very necessary. It's very, very possible. And what I'm trying to say again is that immunization is the key. It's one of the major child survival intervention that we have in public health, which has proven to be safe and effective over the years. And talking about the importance of immunization, immunization prevents death. It protects life. It saves life. It prevents outbreak of diseases, because there are so many. If the populace is not fully immunized, there could be outbreak of diseases that could be fatal to the community and the entire populace. At the same time, it is very, very safe, and it will help us to prevent all these diseases that we are talking about. So it's very, very important. It's a key. It's one of the major child survival strategy that we are talking about.
Okay. I do recall that, we were having a conversation before we came on air, about some of the misconceptions that people have when we talk about immunization and, of course, even vaccination, and also some of the reasons why it seems like some communities don't have an open mind to immunization and vaccination. Could you tell us why some of these things are, some of those misconceptions as well?
Yes, there are misconceptions around immunizations, because when most communities or the general, they believe it's part of the government policy to eradicate the oncoming generation, or to make sure that the population is curtailed. When we talk of immunization, it's not about that. We have said it, that it's because of this lack of awareness and ignorance that all these misconceptions are actually coming in. We could remember when HPV was introduced that time, it was like everybody was like, this is another policy that his government is bringing up to make sure that our children become sterile. This is a misconception. This HPV have been introduced in many countries, and it was well accepted. If they actually know the importance of immunization, you will know that it is not about all what the populace are saying, but it's very, very important, because it's lack of awareness that could make somebody to believe that immunization is a sterile procedure that could make their children to be sterile, or some even believe that if a child is immunized or vaccinated, it will reduce the lifespan. That is the extent of which some communities have gone to. They will tell you that if when you come around to say, okay, we want to vaccinate your child, they will begin to hide them, thinking that if you vaccinate such a child, the child might likely to die young. You could imagine the extent of such a belief. So it has actually proven, it has actually been a major barrier to access to immunization, and to actually record a good progress in the space of immunization.
Okay. All right. Let's talk to us about the theme for this year. And it says that for every generation, vaccines work. And I know typically when the WHO sets themes like this, it is in tandem with what they want this year's drive to be like. Talk to us about it.
Yeah. This African Vaccination Week for this year, the theme, as you said, is for every generation, vaccines work. I've told us that this African Vaccination Week is an annual health campaign that is being implemented across Africa, in which Nigeria is not an exception. It was introduced, and for this year theme, you could see that immunization is for all ages, whether you are old, you are young, or you are an adult, you are a woman, you are a man. For every generation, from generation to generation, not only our generation to come, they will still meet immunization. I could remember when I was young, I was vaccinated, and I'm still living. You can see that immunization cross across every generation, and it has been proven that vaccine works. Because if you look at it from the olden days, all these diseases that kill children, they will say some children are blind. Those are diseases, these are preventable diseases that kill children in those days. And with the advent of immunization, things have changed. Children now live longer. Children live healthier. Children live stronger and well now. To tell you that vaccines work, and to tell you again, we stand with science to tell you that vaccines work, because it has been proven. For every vaccine to be introduced, it has to pass through approval stage, and it has to be tested and be approved. And research have actually shown that vaccines work.
Okay, you have used vaccination and immunization interchangeably in your conversation, and this is one thing that has caused a lot of concern, confusion, I would say. Vaccines, immunization, is it the same thing? Are they different?
Yes, they are not the same. Vaccination as it is just the act of somebody or a person being vaccinated. You can be vaccinated and not be immune, depending on some circumstances that could follow it. But vaccination is just that act of being vaccinated, being given a vaccine. But immunization is all about when the vaccine, the antigen that you have given, now being seroconvert, and the antibodies in your system is stir up to build up immunity against that particular disease. That is immunization.
So vaccination is the act, immunization is the action.
No, vaccination is the act of being given
Given
an antigen just to protect you against infection.
Okay.
Vaccination does not necessarily mean that you are immune. Depending on other circumstances that could play up. But immunization is when your system has actually stimulated antibodies to fight against that particular disease, and you can now say, okay, if peradventure you are being exposed to this particular disease, you might not be infected.
So which comes first, vaccination or immunization?
Yes, vaccination. You get vaccinated against a particular disease.
Now when your body builds the
immunity is when your body builds us immunity against it, that you said that, okay, I'm immunized.
So is that an age range to this right now? So at what age should a person be vaccinated and then immunized again?
Yeah, there are ages in vaccination. For routine immunization, we have schedules of immunization. We have schedules of immunization. Immediately a child is born, it is expected that such a child should be presented at the nearest facility to start immunization proper.
Immediately the child is born?
Yes, we have a schedule. There are some that you have to just take immediately from birth. Immediately the child is born, because there are some diseases that the child does not have immunity against it right from birth. That means that if such a child is exposed at that particular point while the child is born, could be infected. Like take for hepatitis B, for example. Hepatitis B, a child that is born immediately could be infected because there is no protection against this from birth. So it has to be from birth. A child is born today should be presented at the health facility to start immunization. We have schedule, as I've said. If you want me to run through the schedule, I wouldn't mind.
Please do that.
At birth, we have when you have your baby at birth, you give BCG, which is against tuberculosis. You give OPV, oral polio vaccine, which is against poliomyelitis, and you give hepatitis B, which is against hepatitis B infection. Those are the three, those major three. Immediately a child is born, you present yourself at the nearest health center to you, and you make sure that your child is vaccinated against those three infections that I've talked about.
Do they go together simultaneously, or there's a time frame that it goes? So after a month or 3 months, or is it just almost immediately that's being done?
Immediately that is being done. Those three antigens must be administered to immediately the child that is born. Then from there, I've told us that it's a schedule. When the child starts, you make sure that you'll be given appointments subsequently, and you make sure you follow up till the end. You can, when you now get to the end, a child can actually say, I've been fully vaccinated or immunized, as the case may be. So from that at birth, we moved on to 6 weeks. A child will be given an appointment of 6 weeks, whereby you present yourself back again. From there, you'll be given pentavalent vaccine. That is what we call pentavalent vaccine. You commence the dose of it. It's 3 doses. You start the course of pentavalence. You'll be given HPV, inactivated polio vaccine, at 6 weeks. You'll be given HPV. Again, that HPV is part of that pentavalence. Then you'll be given IPV. I've said that. Then rotavirus, antigen is there as well. Those are the ones that you'll be given at 6 weeks. Then from 6 weeks, you move again to 10th weeks, whereby you continue. I've told you that all these pentavalent, HPV, all those ones, they are there are 3 doses in which you have to continue. So you continue again until 10th week. From 10th week you move to 14th week. Then 14th week you move to 9 months of age, whereby the child will be given measles and yellow fever. Now MR has been introduced, measles, rubella. We have a component of rubella in our measles now. So you move from there. You take the meningitis at 15 months, and at 9 months, 9 years of age, a girl is expected to take HPV, human papilloma virus vaccine.
That's more for the female gender?
Yes, for female gender. A female girl that is eligible, a 9-year-old girl should be given HPV, which prevents against cervical cancer.
Okay.
So those are the schedule of immunization that we
should have. Okay, what does it mean when they say a person is immunocompromised? Because we've heard this term time and again. They say a person is immunocompromised, and sometimes they say the person needs more than the regular required dose of a vaccine. What does it mean?
When a person is immunocompromised, means that probably the person is harboring some kind of infection that could predispose the immune system to actually be low. You know, all of us as we are standing because we have our immunity is quite very active. There are some people that their immune system is being compromised, that is not working the way it's supposed to be to work because of some exposure to some kind of infections that could bring down the immunity to be low. That is why we now say that, okay, this kind of person is immunocompromised. And I have some cases like a person that is HIV positive. You don't take good care of yourself, you are not taking good care of yourself, you are not taking, for the fact that you are infected with HIV, you are an immunocompromised person. So that means that if care is all, you are predisposed to all this infection that we are talking more than any other person. So you have to actually take good care of yourself. You are even more entitled, more prone to this infection. So you should, every eyes on you to actually, you are more important to take all this vaccine than any other person, because it builds up your immunity and it will make you to be able to stand against infection ordinarily that will have actually brought you down.
But are they going to get the same dose? Because also there are children who were born with these conditions like HIV. They were born with HIV and AIDS. You know, some of those children, how can they go about this vaccine? Is there any effect at all? Because sometimes the parents will say, okay, now this child has been found to have HIV and AIDS. Can we still give them BCG? Can we still give them the HPV vaccine? If so, how many doses? Are they going to be taking the regular doses that every other person will take?
Yes, I've said that immunization is not contraindicated in immunocompromised person, except otherwise stated. As an immunocompromised person, you are even prone to more infection than any other person. So you are to follow immediately. You are diagnosed as probably you have HIV. You should follow up. What are antigens that you could take that could actually improve your chance of being infected with all this infection that we have listed about. And when a child that is immunocompromised comes, we make sure that we follow them from beginning to the end, that they take the necessary antigen that they are to take, because I've said it, they are prone to infection more than any other person. So they too, they follow the schedule, and we make sure that we give them accordingly. That is they take the same dose actually, and the same vaccines as well.
So according to the WHO, 150 million lives in 50 years has been saved, through vaccination as it is. Now, how is Nigeria currently performing in terms of the immunization coverage as well?
Yeah, Nigeria, we're striving and we're improving. It's just that we still need a consistent effort to make sure that no child is lost. We want to make sure that every child is captured. For us in Nigeria, especially in FCT, we are improving over time to make sure that all eligible children are vaccinated. And with the current situation of things, we can see that the current situation of things, immunization in FCT, we are improving, and we are still, things are getting better every day. And our coverages are not too bad. We are increasing over time, although we are not yet where we're supposed to be, but at least we are not static.
Do you have a data
moving.
of how far we've gone?
Yes, for
as
February, we can say we are 74% coverage.
Okay.
Which
in
is
the
not
FCT or
too
the
bad. That
nation,
is the admin coverage that we have.
Okay.
But I can only talk about
The
FCT
right.
because we are in FCT. But generally in Nigeria, we are not doing badly as immunization is concerned.
Okay.
Things are getting better, the data are coming out, and we are quite improving.
Okay,
Yeah.
so vaccine hesitancy still remains a concern. And I know we did explore some part of these myths and misconceptions that people have, especially when it comes to receiving vaccination. So how has this been addressed? What has the response been so far? How has this been addressed within those communities? How have you tried to solve the problem of hesitancy?
Yeah, hesitancy, as you have said, has actually been one of the major impactful barriers that we have to immunization. If you go to the interiors, especially among the illiterates, among the unread, people that are not well read, that couldn't really understand the importance of immunization, we have actually seen that this hesitancy is of highest order. So what we have been trying to do is that over time we have been trying to make sure that we engage, especially we go deep to these communities. We have our advocacy, social mobilization team that we go to the communities. We make sure that we engage the major stakeholders, the gatekeepers. We sensitize them about the importance of immunization. We make sure that these gatekeepers of the community, they understand it first, so that these are gatekeepers that they are members of the community, and all these, probably, let's take example, what the traditional leaders, they are part of our gatekeepers.
Yeah.
They tend to listen more to their people tend to listen more to them. So we make sure that we work hand in hand with all these stakeholders to make sure that the information, right information, is passed across to the populace. When the right information is passed across, especially for when a vaccine is about to be introduced, we make sure that we don't hold any information about it. We pass good, correct information, and let people take informed decision about that particular antigens that we are talking about. Then because the as I've said, is is a major barrier. We tend to look for immunization survivors. We share stories among people, people that have been vaccinated and they are still well and alive. There is no way I will get to, especially when they are talking about routine immunization. I do use myself as an example that while I was young, I could remember in those days, they will come to our school, they vaccinate. Today we are still living. I have children and I'm still alive. So to tell you that vaccine works and is safe. So when you use yourself as an example to people, you talk to people, they tend to listen more. And those are the efforts that we have made so far in making sure that we combat this hesitancy. And another thing is that the vaccine is free. No money is attached to it. No payment, is free. When anybody comes around, we make sure that you don't have much, there's nothing to pay. It's free and it's effective. And in any way you get to, you can easily access routine those vaccines.
So what are some of the biggest challenges? Now, you've talked about misconceptions, basically, and of course, you've also stated that these vaccines are free. But what are now the biggest challenges that are making, some of these communities not receive the vaccination, the immunization as well? Is it access? Is it funding? Is it misinformation? What do you think are the biggest challenges right now?
According to actually there are many barriers to routine immunization, but we just need to prioritize them. Like if I will prioritize in a space of, let's say, 3, hesitancy is number 1, as we have actually said that we have outlined. Then 2, we have inadequate resources for immunization activities. Let's say, for example, there are some hard-to-reach places that you just have to, our health workers have to go far to get to all these places. And there are some places that they don't come. You just have to take this vaccine to them. There are strategies that we call outreaches. We take vaccination to them. You take it to them. So if they are not enough, there is no adequate fund to actually to carry out this program. You see that is a major barrier. Then another barrier that I could talk about is inadequate skilled health workers. In all of our, we all know the present situation of the country, that our health workers, we are short-staffed. That's just our health facilities are short-staffed. And when we are short-staffed, everybody, skilled workers, they are overwhelmed with work. So it tends to mar the activities of immunization. So those are the major. Then insecurity
It's part of it.
is part of it. Insecurity. Most of the communities in FCD, they are security compromised, that our health workers cannot
get to
those communities. So insecurity is a major barrier too that could lead to
some of the challenges.
But how are these being addressed?
Yeah, especially the hard to reach areas. How do you address
these
them?
hard to reach areas, I've said, we use people within that community. Like we know that a place is hard to reach, especially during campaign. We make sure that we source our health workers from that particular area that lives within that community, so that the stress, or when a place is not accessible like that, it's better to just source our health workers within the community so that they can have access to routine immunization.
Are they trained as well for that particular purpose?
Yes,
yeah.
they were trained.
Okay.
They would invite them for training, but they are part of the community. It's not that somebody will travel there again. They are part of the community. So it's easier to actually access those places with the health workers that are within
those communities.
Then for the security compromise, we do hit and run. With the impact of the vigilantes, we go with the vigilantes and we do hit and run. We make sure that when we hit a particular community that is security compromised, we fascinate them, then we run
go
from
back
the
out.
community, we go back out.
That's such a task. All right, let's talk about the polio situation here in Nigeria. I understand that in 2025 we saw a very significant decrease, about 35%. Says that data says 35% of decrease in polio patients. And I know that, I mean, we've come a long way in the fight against polio. But between March and April of 2026, we saw that there was an active outbreak of variant type 2 of polio. And in fact, we saw that the number of cases were reduced, and they were reported in, I think, 2025 and 2026, primarily in northern states such as Sokoto, Zamfara, Kebbi, and Katsina as well. And in fact, after that was pointed out, in March of 2026, we saw that there was a vaccination exercise that took place, and about 2.9 million children in 2026 of March of this year was also vaccinated. Can you talk to us a bit about that?
Yeah, for the drive against polio vaccination in Nigeria, it was recorded that actually we have eradicated the white polio virus in Nigeria. We no longer have a white polio virus, but the ones that we're having now is we call it circulating derived polio virus. These are ones that are circulating within the environment, within the sewage around us. And we're so lucky in FCT, we have not been recording a confirmed cases of CVPD, as the case may be. For all these other places, but effort is being made. That is why most of the time when we have all this, especially when a case is being suspected, we always mount up a response, outbreak response, so that immediately it will be caught before it begins to spread. Right. Because this circulating derived has a potential again to spread and can lead to outbreak if not properly contained. So immediately it is noted, it is noticed like that, or it is spotted, the outbreak response will begin. And that is why we see us most of the time we come out with polio campaigns, so that before it spread, it will have been cutting. So those are the efforts that is being made thus far. But we're so lucky in FCT.
We don't have any case, which is your area. You seem pretty excited about that. But what is being done about zero-dose children? These are children who have never received any sort of vaccines whatsoever. And we know that there's a timeline for these vaccines to be received. You did make mention of that. 0 to 3 months has, 3 to 6 months has. But these children have missed those timelines. What do we do about children like that?
Yeah, zero-dose children is really a serious concern because we still have them within our community. We have children that there are two definitions of zero dose children. There's programmatic divination and there's contemporary divination, that a child that has not with the age has not taken any vaccine in life. But the programmatic divination or operational divination is a child that is 6 weeks of age and has not received Penta 1, pentavalent vaccine 1, the first dose of it. Those are the divinations of zero dose children. I must tell you that effort has been made. We have them. In fact, I used to say, where are these children? But they're actually within us. Because recently, during this African Vaccination Week campaign, while we're having outreaches, just while we're in a community, we had 2 children that came that's not been vaccinated, a 2-year-old child that has not been vaccinated at all, and a 9-month-old child that has not been vaccinated. These are zero-dose children. These are children that have not been exposed to any form of vaccination in their life. So we still have them in our community. So effort is being made. We want to reduce this, and our caption, as I said, that we want to carry all the eligible children. We make sure that no child is left behind. And that is why effort is being made on daily basis. We'll do go on outreaches. We'll strengthen our routine immunization to make sure that all these children, wherever they are, we capture them and they get vaccinated.
So they can still get the vaccination afterwards, because you said some of those vaccines are age-sensitive vaccines, which means that when they pass a certain age, you know, that's vaccination. You talked about the HPV, you say from 9 to 12, and then from, I think, 16 to 29, you know, there's an age range. What if they have passed this age range? Can they still take the vaccine? Or there are variants to that vaccine for a certain age that can be taken?
We have a catch-up vaccination for children between 11 months of age to below 5 years of age. So if you are still below that particular age, you can still catch up with you. You can commence and you still finish within that space of time that you started. So there's what we call catch-up vaccination for those children that have missed those doses of vaccination.
All right, thank you very much. We are with Ms. Margret, and she has been taking us through the importance of vaccination. Ms. Margret Adeyemi, the State Immunization Officer, thank you for joining us on the conversation this morning.
Thank you very much.
Yes, we're still on it. We will be talking about, we're exploring some of the myths and misconceptions that we have heard. In fact, Victor, I'll tell you one of the most ridiculous things I've heard. You know the BCG vaccine, where everyone has that kind of mark on their hand. I think almost everybody has that mark of the BCG vaccine in their hands, and all of them say that's a mark. It's a mark for what exactly? I don't even know. We would explore some of these myths and these misconceptions, but that will be after the break. Please stay with us.
Time is power. Our lives are powered by the sun. As the sun rises, so do we. As we trust it to rise and set without any worries interrupting your morning. With our hybrid all-in-one inverter, powering our prosperity and happiness. But also nurture what is dear to us, powering trust and support, empowering us to do things that really matters. Star Times Solar, power your life.
Magic has hit your imagination of TV. A brand new sundial with StarTime's inbuilt technology. New TV innovation with an inbuilt decoder that connects you to both StarTime's antenna and satellite signal. StarTimes Sundial TV, you can enjoy over 300 local and international channels, 1 month StarTimes highest bouquet for free, automatic system update. More benefits, more affordable. StarTimes Sundial TV is available in all StarTimes branches and dealers countrywide. StarTimes Inside, entertainment inbuilt.
Welcome back and thanks for staying with us. It's Rapid John right here on Rapid TV, and we have been with Miss Margret Adeyemi. She is the state coordinator for immunization, and we have been talking about immunization, the importance of immunization. And of course, like I said before we went on that break, we'll explore some of the myths and the misconceptions surrounding immunization. Now, before we went, I was talking to you about the BCG vaccine, which is supposed to protect a person from tuberculosis. And most times, my experience from a community was when they said, oh, that was a mark, it had to do with the devil, if they're giving you that vaccine and it's going to leave a scar. But then there are other people that do not have that scar, and they are not also sure whether or not they had been given the BCG vaccine. How can they find that out? And if, as an adult, you eventually find out that, okay, you haven't been given that vaccination, what can you do to protect yourself from tuberculosis?
Okay, thank you very much for that question. For the mark, especially for BCG, everyone that is being administered BCG, it protects against tuberculosis, as I've said, have one mark or the other. If you look at the children, you check their left upper arm, you see that particular sign that is there. Just to show that the vaccine works, number one. Then again, it's just the sign that the person has taken the BCG. For paraventure, you are vaccinated and the mark is not there, and you are an adult here. Most of this infection, I will tell you that you must have developed immunity against them over time as an adult. But if you are not sure, you still want to confirm that are you well protected against this tuberculosis or whatever, you can go for a test. You go for monthly test. Let them check you. Are you immune against it, or are you fine to be without that? You are already, your immunity is already strong against tuberculosis. So that's how it is. You make sure but if you actually been vaccinated, most of the time the mark shows that you have been vaccinated against tuberculosis, which is BCG. You see it's.
I don't have it too.
Actually, it's not everyone that has the mark, but that does not mean that you are not protected.
Protected at all.
That does not really mean that you are not protected.
All right.
Some people, depending on your body system and your body composition, it might not actually show.
Okay. Now there was a major global effort called the Big Catch-up, which delivered over 100 million vaccine doses since 2023. I don't know if you're aware of that. You were. All right. So for Nigeria, how has Nigeria actually benefited from this kind of initiative? Talk about the global catch-up for vaccination.
Yes, we have been able to benefit. We have benefited so much from it. Like last year, was it year 2024 stroke 2025? We have 3 rounds of big catch-up. Is an intensification, routine immunization intensification, to make sure that we catch up everyone that have not been vaccinated or fully vaccinated, whichever vaccine you must have made. So this big catch-up is an initiative of the federal government to make sure that all children, no eligible child is left behind. And it's an integrated approach. It's not only routine immunization, all other services are being integrated with it. You know, we are talking about integration now. That it's not just when you are going, you go with only vaccine. All other services accompanying it as well. And we actually recorded a very, very big success concerning all those programs when it was implemented in FCT.
So many people think that vaccines are only for children. And in fact, in this conversation, we've been talking about children. But what vaccines are available for adults, and what vaccines should we pay attention to as adults?
As an adult, that's probably when you are young, you have been fully vaccinated, but there are still some that you need to take while you are an adult. Like if you have not been given hepatitis B vaccine, it is good as an adult that you take it as well, because hepatitis B is a viral infection of the liver that is very infectious. It's very, very infectious. It can It's a group of men you can easily be infected. So if you are an adult, you need to get tested, and if you are tested and you are negative, you go for the vaccine. It's very good as an adult that you take it. Even this HPV that we are talking about, although we have the routine immunization, which is for eligible girls of 9 years of age, but as a woman that you are still in your childbearing age, you are still below 45, you can go for pap smear, get yourself tested against cervical cancer, and if you are negative, you can take the vaccine as well. It's just that you are out of the caption of the routine immunization. You sort it out for yourself.
But the pap smear is an invasive procedure. Yeah. So which means that it has a limitation for both sexually active and non-active people. So how can we create this balance between both parties?
As a pap smear, for me, what I know, it has been one of the most effective way of preventing cervical cancer. If you present yourself, you go for pap smear, you can easily be tested if you are free. Okay. If you are not infected, because there are so many strains of it as well, of HPV, as we know. So if you are free, I think you can from there go for your vaccination. Okay. I think it's one of the most very available tests that women that you can go to actually know whether you are infected or not. So it's very, very important that a woman go for pap smear regularly, at least every 3 years, so to be.
So for adult vaccines, are they also free? Because I recall you mentioned for children they are free. So
let's know if this is discrimination.
So are they free?
As I've said, adult vaccine, they are not free because they are not within the target population of routine immunization. So if you want to take any of this vaccine that you feel that you assess it. You can assess it and pay. Although it's all available, but you will pay.
You pay for those vaccines. Okay, we know that some of these major health, should I call them, the funders, UNICEF, USAID, some of all these people and projects that they carry out within the organization, we have been beneficiaries of this project. For not just that, Gavi as well. Now, we know that USAID has exited Nigeria, and this has been one of the major funders of both these vaccines, immunization, and all of that. What has the effect of that been in the health space, especially in regards to immunization?
As you have said, we still have partners that are supporting routine immunization. They have not actually, as you said, they are winding up their program as it is. It is clear because all the funds that we used to get for this routine immunization activity is being reduced on daily basis, but not all of them have actually packed up. We still have most of our partners. We have UNICEF, we have WHO, we have many other partners that are still supporting routine immunization. And that is where we are now. That is where we are. Because of the effect of all these partners, we have been able to carry on with the routine immunization activity with the effort of the government. If not, for someone to assess all these vaccines, they are not cheap vaccine as it is. That's why people think it is free, but some people actually pay behind the scene to make sure that these vaccines are available for the populace. So it's not really free. We still have supporters, we have partners that are still sponsoring.
But can we, as Nigeria, can we sustain the financing of our vaccines?
Yes, we can. Our government, they are up to the task to support. If peradventure these partners are finally winded up or rounded up, I think the government is able to pick up from there and will still sustain it, because routine immunization we cannot do without immunization. It's the key. It's one of the major child survival strategy that we have, and it is effective, it is safe, and as you know, prevention is better than cure. So it's better we prevent all this infection from being happening than to now be talking of the curative aspect of it. Is less costly than the curative aspect of it.
So for parents who actually have delayed the vaccination and immunization of their children? What should they do immediately, to catch up?
The parents that have their children have missed immunization, I want just to enjoy them, that they should delay no further. Immunization is a national program that every corner in your community, you have a PAC there that you can easily access routine immunization. Then you think of the importance of routine immunization. That is one of the major child survival strategies that could make your child to go very healthy and strong. So if your child has missed it, there is still opportunity. If you go to the nearest health center to you, they will look at your child, all the antigens that your child is due for, they will start from there, and they will make sure that you finish it so that your child can be fully vaccinated as well.
Okay. One of the major issues that I believe we have pointed out here today is hesitancy, right? Which is one of the major hindrance to the spread or the acceptance of vaccine generally. So how are you able to build trust within these community members that have these myths and misconceptions stored up somewhere? Because it would take a lot. I mean, you need to convince them to get the vaccine many times. So how can you breach that gap of trust and ensure that more communities experience some level of acceptance, much more than what it is right now?
Yes, awareness program, as I've said, because one of the importance of even this African Vaccination Week, as you have said, is to create more awareness, to promote immunization, to create more awareness on the importance of vaccination, the importance of vaccination. So we go into the we make sure that we make sure we avail every opportunity that we have to talk about immunization. This is part of it. As we are here in the media house this morning to talk about immunization, many people are hearing us and they are being more informed about immunization. So we make sure that we sensitize the populace. We talk about immunization in everywhere we find ourselves, in the communities, in schools, in our environment. We don't keep quiet about it, knowing fully well the importance of routine immunization. And I've said earlier, we don't do it alone. We work with our traditional leaders, religious leaders, all the gatekeepers that people could listen to. We make sure we work with all these people so that people they can listen to. We pass the message in the language that people understand. We break it down into the level of the community, the language that they understand, so that they'll be able to understand what we are saying. Because if they don't understand, we are just passing information without being them understood what we actually say. So we make sure that we break the information down, and we make sure we pass the correct information. We don't hide anything concerning immunization. We tell them the importance of routine immunization. We talk about even side effects. Most of the time we go to the extent of telling them earlier some of the adverse events following immunization. There could be some event that could follow immunization. We make sure we tell them so that they will know on ground and they will be able to manage it when it happens, so that it will not be a barrier to accessing the further immunization services.
All right, thank you. I think that will wrap it up. That part where you tell them the side effects is super important, because there's one that you give a child and the child is cranky from the night till the morning, and then the parent goes and says, what happened to my child? Why is the child so cranky and all of that? But thank you so much for educating us this morning on immunization and the importance of taking this immunization. All right, we have been with Ms. Margret Adeyemi. She's the State Immunization Officer, and this is where we'll wrap it up with her here and now. Thank you again for joining us on the show.
Thank you very much for having me.
Thank you so much for coming.
Thank you.
All right, just before we wrap up, it's important that we internalize this message because it is important that we understand why vaccinations. It's not just a routine exercise. It's important. It's for survival. And if every child must grow rightly, they must be able to take this vaccination and immunizations as it is being expected of them and advised by the WHO.
Very true. And of course, our guest has told us right here that immunization saves lives. And for you to protect your child, you have to start with this simple decision. Immunize your children, vaccinate your children, and that's the only way for you to protect them.
All right, and this is where we also wrap it up here on the Rapid Dawn this morning. Remember, we are active across social media platforms. On Facebook, on Instagram, on TikTok, it is at Rapid TV. On YouTube, it is at Official Rapid TV. Our website, www.rbnradiotv.com, allows you to connect with us from anywhere in the world. Thank you so much for joining us this morning. Once again, my name is Martha Alu.
And my name is Victor. Okay, we will see you tomorrow.